Today we are going to start our new chapter from industrial pharmacy, that is nothing but the parenteral preparations. So in the parenteral preparations, what is important? We'll see that. So you know that we have seen pre-formulation, tablet, capsule, suspension, emulsion, suppository, aerosols, and we have seen these chapters from industrial pharmacy. From physical pharmacy, we have seen micromatics, rheology, and your surface tension, interfacial phenomena, and colloids. Four chapter from physical pharmacy is completed, and from industrial pharmacy, tablet, capsule, suspension, emulsion, suppository, aerosols, and pre-formulation. These chapters are completed, and next part is nothing but the parenteral preparations, or you can say sterile preparations. So these we'll see today and tomorrow, and from Monday we'll again start remaining. Right? Parenteral products. What do you mean by parenteral products? Simply, so parenteral means para-enteral. Parenteral means para-enteral. It is made from two words, para and enteral. Enterus or enteron means your intestine, and parenteral means without. Para means without. So without intestine. So these drugs are given not through intestine. So these drugs are given by through other routes like inhalation route or injectable route, right? So various kind of injections are there like intravenous, intravascular, then subcutaneous, then intradermal, transcutaneous, intraarterial, intraarterial, intraarterial. So different kind of intrathecal, different types of injections are available. So para means without and enteron means intestine. So oral drugs, if you take a tablet, so tablet will go in the stomach, will disintegrate over there, and there is a dissolution of drug in the various body fluids, and then there is absorption. So absorption of drug given by orally, it is through a intestine. That's why the oral route is also called as an enteral route. Oral route is called as an enteral route. Other routes which are not, in which there is no involvement of GIT, that is another parenteral route. Even topical route is also considered as a parenteral because para means other than and enteral means enteron. So even topical route is also considered as a parenteral route. Inhalation route is also considered as parenteral route. Right? So drug which is given by other than intestinal route or other than intestine, or which is not absorbed by through intestine, known as a parenteral. Right? So in this you will have various kind of parentals. We have seen the various types of route of administration. So oral route, okay. Then we have seen topical route, we have seen rectal route, we have seen the injectable route, sublingual, etc., etc. So different types of injections which are available. So they are given in different type of tissue. So you have different tissues over your skin. You have skin, you have layers of skin, you have muscle, you have adipose tissue, subcutaneous layer, you have vein, you have arteries. Okay. So depending on that, different route of administration, parenteral route of administration. First, you can see over here. So this part is known as the epidermis. Uppermost part of skin is epidermis, right? Then below the epidermis there is a dermis. Below the dermis there is a dermis. Okay, and dermis is also having 2-3 layers, but don't go into detail. After the dermis there is a subcutaneous tissue. Subcutaneous tissue. After that, subcutaneous tissue के बाद में subcutaneous adipose tissue or simply adipose tissue. Then lastly, you will find the muscle and veins, and below this you will find the artery, right? So different routes of administration of parenteral drug or injectable drugs. So intradermal route. First is the intradermal route. So injection is given in the dermis, layers of skin, and you know that what is the limit? 0.2 to 0.5 ml. 0.2 to 0.5 ml. So we have already seen these limits in the somewhere else. 0.2 to 0.5, right? Then subcutaneous route. So injection is given in the cutaneous tissue. Again, not more than 2 ml. Not more than 2 ml. Then intramuscular injection. So injection is given in the muscle at the 90-degree angle only. During the intramuscular injection, angle between the tip of needle and muscle or skin should be 90 degree. For intravenous, it should be 45 degree, more than 45 degree. Like that. We have also seen that also. Intramuscular. Lastly, intravenous. So drug is injected directly into the veins. Drug is injected into a dermis or dermal area of your skin. Subcutaneous means injection of drug into the subcutaneous tissue. Intramuscular means injection of drug into the muscle tissue. Intravenous means directly introduction of drug into the vein. And one more route, intra-arterial. So likewise this is a vein. ये वेन जो होता है वैसे आर्टरी होती है, इसके नीचे आर्टरी होती है, आर्टरीज आर डीपली सिटेड. So injection of drug into artery is intra-arterial injection. So they are seldomly given. Then intraperitoneal injection. Intraperitoneal. Stomach is well, injection is given in the peritoneal cavity. It is intraperitoneal injection. These are the different types of injections. And parenterals means what? Paraenteral. Those drugs which are given by other than internal route, known as a parenteral. So these are the different type of injection. Now we'll see the formulation parameter, excipient, different type of vehicles, different type of additives used in the parenterals, different requirements of parenteral preparations, which are very important. And you can expect at least 3 questions or 4 questions from this chapter. This chapter is very important again. And I hope you are able to see the screen and I am audible to you. So first, very important, you should know the volume of injection that can be given by different routes. Volume of injection, इसके ऊपर क्वेश्चन आ चुका है and you should know. So route of administration is given. Primary parenteral route. Primary parenteral route. Okay, small volume parenteral उसमें primary parenteral routes and इसमें small volume parenterals. Now small volume and large volume parenteral. There are two type of parenteral injections. There are two type of parenteral preparations. Small volume parenterals or and then large volume parenteral. Small volume parenterals means so like your ampoules and vials. In the ampoules you have 2 ml, 3 ml ampoules. In the vials the quantity of final solution for injection or suspension or emulsion for injection may be up to 30 ml. And from vial is considered as a multi-dose container. Ampoule is known as a single dose container. Ampoule में जो injection होता है single use के लिए होता है. You have to break the ampoule, you have to suck all the liquid in the needle, in the syringe, and then you have to inject once only. Then in case of vials, it is a multi-dose container. So you can withdraw 2 ml when patient comes, you can inject them and you can keep the vial again. And when next patient will come, you can also withdraw 2 ml. So vial may be of 10 ml, 20 ml, 30 ml, 50 ml, okay? But not more than 50 ml. Vial 50 ml तक ही होता है, right? Now these are known as the small volume parenterals. Large volume parenteral means so those which are given in the liters, like for example IV fluids, intravenous fluids, like DNS, dextrose normal solution, RL, Ringer's lactate solution, D5, D50%, right? Like that. Okay, so those parenterals known as a large volume parenterals, okay? Because you have to introduce large volume of that fluid into the vein, okay? Large volume parenterals. Now large volume parenterals, they will not require any preservative. They are terminally sterilized preparations. They are made through aseptic technique and they are not having any preservative. इसके ऊपर क्वेश्चन आया last time, GPAT 2000. Which of the following parenteral preparation will not require preservative? Large volume parenteral will not require. Okay? Small volume, they are having preservative. Okay? We are going to see it. So okay, first one is a subcutaneous injection. So subcutaneous injection, and through the subcutaneous route you can inject, through the subcutaneous route you can inject 0.52 to 2 ml. Okay, usual volume that can be injected. Usual volume that can be injected by subcutaneous to 2.52 to 2 ml. Now mostly it is used for applicable for insulin and vaccines. Insulin vaccines, they are given by subcutaneous routes. Need to be isotonic. These preparations needs to be isotonic. But what is meant by isotonic? So isotonic means the preparation or injection should be isotonic means what? So it should have same osmotic pressure as that of the blood plasma. Isotonicity means what? So they should have same osmotic pressure as that of the blood plasma. Okay? So subcutaneous injection should be acidic. Then intramuscular injection, so you can inject 0.5 to 2 ml again through intramuscular. 2 ml दिया है लेकिन you can inject up to 5 ml. 5 ml तक inject कर. Nearly all kind of drug that can be formulated in the intramuscular injection. They can be formulated in the aqueous vehicle as well as oily vehicle, है ना? But oily vehicle अगर use करते हैं, so the injections are painful. Now it can be solution emulsion or preferably it can be solution emulsion or colloidal suspension. Preferably it should be isotonic. Then large volume parenterals, right? तो एक क्वेश्चन आया है, thousands of liter intravenous fluid can be thousands of liter of fluids can be injected by following route intravenous route. Okay, इसके ऊपर क्वेश्चन है. So 1 to 1000 ml or 100 ml large infusion unit. Nearly all kind of drug classes it can be formulated into intravenous injection. So I put solutions and some emulsion that can be introduced. Other parenteral routes कौन से? Other parenteral routes. So intra arterial. So drug is given into artery, directly into the artery. 2 to 20 ml drug can be injected, and that is mostly used for the diagnosis purpose. So radiopaque media, then anti-cancer drugs, then anti-cancer antibiotic, they are given by intra-arterial route, directly into the artery, for the immediate action. For the immediate action. So solutions or sometimes emulsions can be injected. Solution injection कर सकते हैं, emulsion inject कर सकते हैं. Next होता है आपका intrathecal route or intraspinal route. So drug is injected into the subarachnoid space of your spinal cord. इसके ऊपर क्वेश्चन होता है. Intrathecal means क्या? Drug is injected into the subarachnoid space of your spinal cord. Intra, okay. So 1 to 4 ml drug that can be injected. यहाँ पे क्या होना चाहिए? It must be isotonic and it must be isobaric with the CSF. Okay, it must be isotonic, isobaric. Okay, mostly local anesthetic drugs are given by this route for diagnosis purpose also, etc. Then intraperitoneal is also a kind of intrathecal only, but it is injected in the dural, okay, duramat 6 to 30 ml again. Okay, same kind of drug. Intracisternal injection. Intracisternal means directly injected into the brain between the cerebellum and medulla oblongata. तो आपको ये क्वेश्चन आया सकता है. What is intracisternal? Intracisternal means directly into the brain. तो सब में उसमें डिपेंड करता है इंजेक्शन का कौन सा होगा, एंड ये सब isotonic होगा. Okay, it should be sterile parent, it should be sterile, free from pyrogen वगैरह सब. Then intra-articular injection. Intra-articular मतलब articulation कहाँ पे होता है? Joints में होता है. So two bones are articulated. So directly into the bones, 2 to 20 ml that can be injected. Mostly painkiller and steroidal drug. So in case of your arthritis, joint arthritis है या rheumatoid arthritis है या फिर gout है, उसमें morphine देते हैं या फिर local anesthetic inject कर सकते हैं, NSAID inject कर सकते हैं या फिर steroids inject कर सकते हैं, and must be isotonic. Then intracardial injection. Intracardial means directly into the muscle of heart. 0.2 to 1 ml that can be injected. So कौन से ड्रग यूज करेंगे? कार्डियोटोनिक ड्रग, कैल्शियम प्रिपरेशंस, they are used, okay, to prevent, है ना, हार्ट में. Then intrapleural. Pleural मतलब pleural cavity, directly into the pleural cavity of lungs. So 2 to 30 ml, that is the injection volume. Mostly local anesthetic, narcotic and antibiotics are injected. Then next होता है diagnostic testing के लिए intradermal. So not more than 0.05 ml. Diagnostic purpose should be isotonic. So these are the different type of route or the different routes through which parenteral product can be given, and volume of injection is very important. Volume of injection important. This chart is also given in the Lackman. Okay, industrial pharmacy by Leon Lackman. Now sterile are the dosage form or of therapeutic agent or dosage form containing a drug that are free from any viable organism. That are free from any viable organism. Viable means क्या होता है? Viable मतलब जिंदा. any form of viable organism. Parenteral products or sterile preparation should be free from any viable form of organism containing drug and should be isotonic with the body fluid and pyrogen free. These are the product includes parental products, ophthalmic product and irrigating solutions. ठीक है, तो स्टेराइल प्रोडक्ट में आपका पेरेंटल प्रोडक्ट आता है, पेरेंटल मतलब इंजेक्टेबल्स, देन ऑप्थेल्मिक आता है, ऑप्थेल्मिक मींस दोस प्रोडक्ट यूज्ड इन द आई, है ना, जैसे आई ड्रॉप्स एंड इरिगेटिंग सॉल्यूशंस. सो ऑल these are nothing but the sterile preparations, right? So parenterals, ophthalmic and irrigating solutions, these are major because these have they have circumvented or they are crossing the highly efficient first line defense of body, that is skin. Because injection आप skin के through देते हो ना, you are injecting in the vein, you are injecting in the subcutaneous tissue, mucous membrane. So they should be pyrogen free, they should be isotonic, they should be free from any viable form of microorganism. Why? Because you are circumventing the first line defense of your body, that is skin. तो skin क्या होता है? First line defense of your body. Therefore they must be free from microbial contamination or toxic component. Toxic मतलब ये pyrogen. They must be free from toxic component, endotoxins, etc. They should possess exceptionally high level of purity. Purity ज़्यादा होनी चाहिए. Parental preparation may be given by various routes like intravenous route, intraspinal route, intramuscular, subcutaneous, intradermal. Depend upon routes. So yes, okay. Okay, there was a question. Bioavailability is 100%. Bioavailability is 100% when drug is given by intravenous route. Bioavailability is 100% when drug is given by intravenous route. So what do you mean by bioavailability? Bioavailability मतलब क्या होता है कि availability of biologically active drug. So means क्या है कि जो ड्रग दिया है आपने वो ड्रग एज इट इज आपके सिस्टमिक सर्कुलेशन में है, तो उसको बोलते हैं बायो अवेलेबिलिटी. और जितना दिया उतना है तो 100% बायोअवेलेबिलिटी. अभी जब ओरली देते हैं तो ओरली कुछ पार्ट ड्रग का जीआईटी के फ्लूइड में डिस्ट्रॉय हो सकता है या फिर कुछ जो डिस्ट्रॉय नहीं हुआ एब्सॉर्ब कम हो सकता है. अगर एब्सॉर्ब कम होगा तो प्री सिस्टमिक मेटाबॉलिज्म दिखा सकता है, फर्स्ट पास इफेक्ट दिखा सकता है. So only few amount of drug will reach to systemic circulation. That's why bioavailability of oral products are less as compared to the injectable forms. Why? Because if you are injecting into vein, you are putting a drug directly into the vein. Right? That means bioavailability is 100%. इसके ऊपर क्वेश्चन आ चुका है एक बार. Intravenous and intraspinal preparation they are rarely given in a non-aqueous solution. Intravenous जो है intravenously एंड इंट्रास्पाइनल प्रिपरेशन, स्पाइनल कॉर्ड में इंजेक्शन देना है, इंट्राथिकल इंजेक्शन देना है, इंट्रावेनस मोस्टली वो सॉल्यूशन ही होना चाहिए, एक्वियस सॉल्यूशन होना चाहिए, एक्वियस सॉल्यूशन होना चाहिए, है ना, एक्वियस सॉल्यूशन. दे आर रेयरली गिवन एज अ इमल्शन. ओके, इमल्शन जैसे एक्सेप्ट माइक्रो इमल्शन इंट्रावेनसली दे सकते हैं. प्रिपरेशंस गिवन इंट्रामस्कुलरली और सबक्यूटेनियसली. जो सबक्यूटेनियसली देते हैं, इंट्रामस्कुलर देते हैं या इंटरनर्मल देते हैं, that can be administered as a solution, suspension और emulsion, है ना. तो इंट्रावेनस इंजेक्शन जब देना है आपको तो वो फॉर्मुलेशन आपको मोस्टली सॉल्यूशन बनाना है, नॉट अ सस्पेंशन, नॉट अ इंजेक्शन, सॉरी नॉट अ इमल्शन. बट अगर माइक्रो इमल्शन है तो चलता है. बट अगर आपको इंट्रामस्कुलर इंजेक्शन बनाना है, इंट्राडर्मल इंजेक्शन बनाना है, सबक्यूटेनियस इंजेक्शन बनाना है, so in that case you can formulate your product into suspension, emulsion, solution also. Even some solid pellets that can be transplanted into the subcutaneously or intramuscularly. Now next is nothing but the excipient used in the parenterals. तो parenteral preparation क्या है आपने देखा है अभी. So in the parenteral as like your tablet dose, tablet में क्या है API plus additives है, excipient है. So likewise this आपका एक ड्रग लेके आप सॉल्यूशन नहीं बनाओगे, उसमें स्टेबिलाइजर्स आएंगे, उसमें टोनिसिटी मॉडिफायर आएंगे, आइसोटोनिसिटी मॉडिफायर आएंगे, उसमें प्रिजर्वेटिव आएंगे, उसमें व्हीकल आएगा, है ना. व्हाटएवर is there known as the excipient. So additives used in the parenteral preparation, excipient used in the commercial parenteral product. So along with your drug तो रहेगा, ड्रग के साथ में और क्या क्या हो सकता है. So first one is the antimicrobial chemicals or simply preservatives. So what kind of preservatives they are used in the parenterals? Remember, preservative they are not used in the large volume parenteral. लार्ज वॉल्यूम पैरेंटल में प्रिजर्वेटिव यूज नहीं करना है. Preservatives are only used in the small volume parental, not used in the large volume parental. Now, benzyl alcohol is used in a 0.5 to 10%. Then benzonium chloride 0.01%. Butyl paraben in a 0.15%. Then chlorobutanol 0.25 to 0.5%. Metacresol 0.1 to 0.25%. अपन ये क्यों देख रहे हैं? क्योंकि sometimes they used to ask question on this. Methyl paraben इसके ऊपर आ चुका है. Methyl paraben is used as a preservative in the parental in a concentration of. So it is used in the concentration 0.01 to 0.08. Myristil gamma fucolinum, that is used as a preservative in 0.17%. ये इसके ऊपर पूछा है. Myristil gamma fucolinum is used as dead dash additive in the parental. It is a preservative or antimicrobial agent. Suppose आपके पास है vial, okay, आपके पास है vial. Ampoules are nothing but the ampoules are single dose preparation, and if you are not adding any preservative in the ampoules, then it's fine. But for vials you need a preservative, because from vials, so you have to withdraw the injection और मल्टीपल डोज. फ्रॉम ऑयल में क्या है, ऑयल में अभी 2 ml निकाला, कल दूसरा पेशेंट आएगा उसको 2 ml डाले ना, डाइक्लोफेनाक इंजेक्शन आईपी 20 ml 30 ml का ऑयल मिलता है. सो यू हैव टू विथड्रॉ द इंजेक्शन frequently. So you have to keep that oil open for a particular period, say for example 10 days, 15 days, depending on your requirement. So during that it may get contaminated. Now if it is contaminated, then there might be growth of bacteria. So to prevent that, antimicrobial preservatives are needed. So remember, chloride, phenol, okay, phenyl mercuric nitrate. Okay, phenyl mercuric nitrate is used in this concentration 0.001. इसके ऊपर क्वेश्चन आ चुका है. phenyl mercuric nitrate, propyl paraben 0.005 to 0.035, thiomersal 0.001 to 0.02. So ये preservatives important है, कभी-कभी क्वेश्चन आता है. So ये तो मोस्ट कॉमनली यूज होता है phenyl mercuric nitrate, and then your benzalkonium chloride पे होता है. Second, stabilizer, wetting agent or emulsifying agent. Stabilizers, wetting agent or emulsifying agent. So if you are making a suspension or if you are making a emulsion, if your solution is unstable, so you have to add stabilizers, solubilizers, wetting agents and emulsifiers. So diacetamide is used in 0.01%. Dioptyl sodium sulfosuccinate is used as a surfactant, that is 0.015%. Egg yolk phosphate also we use 1.2%. Ethyl alcohol is a co-solvent, ethyl lactate co-solvent, 1.2. 0.1, ethyl alcohol is used in this concentration 0.61 to 0.5. You can say 0.52 जितने भी यूज. Then glycerin, lecithin, polyethylene glycol, PEG40 castor oil, polyethylene glycol 300, polysorbate 20, 40, 80, povidone, sodium, okay, propylene glycol, sodium deoxycholate मतलब ये कोलिक एसिड का सॉल्ट होता है. Then sodium sorbital monopalmitate. So these are used as a solubilizers, wetting agents or emulsifier. So जितने भी surfactant है ये यूज करते हैं. Concentration range इसका important नहीं है. तो now buffers. So commonly used buffers. Buffer means what? Buffer is a kind of preparation which can resist the pH change upon addition of small amount of alkali or base. They consist of a weak acid and its salt. Weak acid and its salt. Weak base or its salt. Weak base or its salt. They will resist the pH change. Okay. So different type of buffers used in the parentals. कितने buffer है देखो यहाँ पे. Acetic acid, adipic acid, concentration acetic acid का 0.22, adipic acid 0.1, benzoic acid and sodium benzoate 5%, citric acid, lactic acid, malic acid. Sodium phosphate buffer is also used. Sodium phosphate monobasic buffer in a 1.7% weight by weight. sodium phosphate diabasic, sodium acetate, sodium carbonate as a buffer, sodium bicarbonate as a buffer, sodium citrate, tartrate and tartric acid. These things they are used as a buffer. आपको कभी कोई क्वेश्चन आएगा कि what is the role of sodium carbonate in the parenteral preparation as additive? So it is a buffer. It will reduce the change in the pH. pH change क्यों हो सकता है? माइक्रोबियल कंटामिनेशन या फिर आपका और ऑक्सीडेशन हाइड्रोलिसिस की वजह से. Now bulking substances or tonicity modifier. Bulking agents or tonicity modifier. Isotonicity modifier. So 0.9%, 0.9% weight by volume. Sodium chloride, 0.9% sodium chloride is isotonic with the blood plasma. The isotonic with the blood plasma. So when you prepare a 0.9% weight by volume solution of your sodium chloride, that solution is isotonic with the blood plasma. मतलब जो 0.9% सोडियम क्लोराइड है उसका अगर ऑस्मोटिक प्रेशर चेक करेंगे और ब्लड का ऑस्मोटिक प्रेशर चेक करेंगे तो सेम आएगा. So that's why 0.9% सोडियम क्लोराइड अगर इंजेक्ट करते हैं there is no hemolysis of RBC. अगर ज़्यादा अगर हाइपोटोनिक एंड हाइपरटोनिक इंजेक्ट करेंगे तो फिर प्रॉब्लम होता है. हाइपरटोनिक इंजेक्ट करेंगे that will uh, pull up the blood from your RBC will shrink. and hypotonic ऐड करेंगे तो that will be shrink. and hypertonic ऐड करेंगे so there is a release of water from RBC, there is a absorption of water from RBC, like this. Creneations and bursting we have seen already in the blood. So what are the bulking agents or tonicity modifier? Glycerin ये क्या है? bulking agent. Lactose, mannitol, dextrose, sodium chloride is a tonicity modifier, and sodium sulfate, sorbitol. Sodium chloride is a tonicity modifier, then dextrose is also tonicity modifier. बाकी आप bulking agent बोल सकते हो. Now suspending agent. So if you want to prepare a suspension, gelatin is used in 2%, ethyl cellulose in 0.03 to 1.05%, pectin and polyethylene glycol 4000. They are the bulking substances of tonicity modifier. को याद रखना है. Now next one is again you can see sodium carboxy ethyl cellulose again है ना bulking agent sorbitol solution. Chelating agent कौन से? To prevent the what is the role of chelating agent? To scavenge the metal ions. So sodium irritate is used. Irritate calcium by sodium. Irritate tetrasodium irritate. Local anesthetic इसके ऊपर क्वेश्चन आ चुका है. Local anesthetic used in the injectable. क्यों करना है local anesthetic use करना है? Because if injection is painful, so local anesthetic will decrease the pain. So benzyl alcohol याद रखना है आपको. Benzyl alcohol and propane hydrochloride they are used as a local anesthetic in the injectable. याद रखना है इसके ऊपर क्वेश्चन आ चुका है. Stabilizers like creatinine, glycine, niacinamide, sodium acetyl, tryptophanate, sodium caprylate, sodium saccharin. These are used as stabilizers. To stabilize concentration not important. Now formulation concentration of your parenteral product. तो आपका तो parenteral product में क्या रहेगा? पहले तो drug रहेगा, means API. drug रहेगा मतलब API, active pharmaceutical ingredient. API आपका रहेगा plus vehicle. अभी API dissolve तो करना पड़ेगा ना किसी में. So you have to dissolve your drug. You have to dissolve or you have to permanent emulsion with the drug. So you need a vehicle. So what kind of vehicles are used in the parenteral product? Vehicle कितने टाइप के होते हैं? Mostly parenteral के लिए आप कितने टाइप के यूज कर सकते हैं? एक तो यूज कर सकते हैं aqueous vehicle और दूसरा आपका है oily vehicle. Aqueous vehicle and oily vehicle या फिर हाइड्रोअल्कोहलिक भी नहीं यूज कर सकते. So aqueous vehicle means those which is containing the water. Aqueous vehicle मतलब क्या? water containing vehicle. इसमें बहुत सारे टाइप आते हैं. there are different type of waters they are used in the parenteral preparation. Aqueous vehicle इसमें आएगा water for injection, that is a WFI. Sterile water for injection, sterile water for injection, sterile water for injection, bacteriostatic water for injection. These are bacteriostatic water for injection. They are not used as a vehicle, but water for injection and sterile water for injection, they are used as a vehicle. Okay. For non aqueous है ना, मतलब अगर ड्रग आपको वाटर में डिजोल्व नहीं है, for that non aqueous vehicles are used. So water miscible solvent like dioxin, diastamide, N-methyl lactamide, butylene glycol, propylene glycol, PEG 600 or PEG 800. That is a non aqueous vehicle. So glycerin is used. Ethyl alcohol can be used. तो vehicles for पेरेंटल प्रोडक्ट तीन टाइप के होते हैं, एक्वियस, नॉन एक्वियस एंड वाटर मिसिबल सॉल्वेंट, और ऑयली भी होते हैं, पर्टिकुलरली फॉर इंटरमस्कुलर इंजेक्शन ऑयली भी हो सकता है. वाटर इमिसिबल सॉल्वेंट कौन से है, देखो इमिसिबल सॉल्वेंट लाइक फिक्स्ड ऑयल्स, जैसे एचएस ऑयल हो गया, फिर ग्राउंड ना, कोई भी ऑयल है, ऑयली इंजेक्शन दे आर पेनफुल. इथाइल, ओलिएट, प्रोपाइल, माइरिस्टेट, बेंजाइल, बेंजोएट, these are the water immiscible solvent or oily vehicle. Most commonly used non-aqueous solvent are nothing but the most commonly used non-aqueous solvent are nothing but the polyethylene glycol, polypropylene glycol and fixed oils. So यहाँ पे याद रखना है कि आपको along with the API you need a vehicle. And vehicle there are three types: so aqueous, non-aqueous, okay, and water immersible. Aqueous, non-aqueous, water immersible. Are you getting? These are the vehicles used for the. So there are four type of vehicles are used. So first vehicle we have seen the aqueous vehicle, that is water containing, water for injection, sterile water for injection. Right? Non-aqueous में आएगा आपको water miscible solvents like dioxin, diastamide, etc. Water immiscible solvent or oily vehicle. Third, water immiscible solvent or oily vehicle. So next is nothing but the basic criteria for these vehicles used for the पेरेंटल्स. पेरेंटल में जो व्हीकल यूज करेंगे उनका क्राइटेरिया क्या है? दे शुड बी पायरोजन फ्री, दे शुड बी पायरोजन फ्री, दे शुड बी should meet the particular criteria, they should be pyrogen free. What are the pyrogens? They are nothing but the pyrogens are nothing but the metabolic product of your bacteria. They are the metabolic product of bacteria. The metabolic product of bacteria, and they are nothing but the chemically lipopolysaccharide. Lipopolysaccharide, they are the lipopolysaccharide. So what they do, they will interact with your COX-3 in the brain, they will increase the body temperature, right? Increase in the fever, that is known as a pyrexia, that's why they are known as the pyrogens. Now parenteral preparation or vehicle should be pyrogen free, that must be pyrogen free, and pyrogens are nothing but the metabolic product of your organisms, particularly they are the lipopolysaccharide and maybe sometimes peptide भी हो सकते हैं lipopolysaccharide. They are okay. Gram-negative bacteria will produce most potent toxin known as endotoxin. Gram-positive bacteria जो होता है वो endotoxin produce करता है. Endotoxin, they are nothing but the kind of pyrogens. They increase the body temperature. They causes chills in the body, cutaneous vasoconstriction, rise in the arterial blood pressure. Now ये कहाँ से आता है? Source of contamination क्या होगा उसका? Source of contamination of these pyrogens in the water. That is nothing but the water. They are may be present in the water, they are may present in the contaminated solute or container. तो ये कंटेनर से आ सकते हैं pyrogens, या फिर जो वाटर है आपका यूज कर रहे हो उसके से आ सकते हैं, या फिर आपके है ना आपके सॉलिड में हो सकती है, कंटेमिनेटेड सॉलिड. नाउ क्वेश्चन आ चुका है रिसेंटली, कंटेनर्स कैन बी रेंडर्ड pyrogen फ्री. कंटेनर्स कैन बी रेंडर्ड pyrogen फ्री मतलब आप कंटेनर कैसे pyrogen फ्री कर सकते हो? कंटेनर for the parental may be rendered pyrogen free by adequate cleaning, then heating usually at a 210 degrees Celsius for 3 to 4 hours. 210 डिग्री में उसको जो कंटेनर है you have to heat that container 3 to 4 hours for 210 degree. Okay? GPAT 2019 में ये क्वेश्चन है. The containers can be rendered pyrogen free by heating usually at a 210 degree for 3-4 hours or by heating at a 650 degree for 60 seconds. 650 डिग्री में हीट करना है 60 सेकंड के लिए, 1 मिनट के लिए. However, autoclaving temperature does not destroy the pyrogens. Normal cycle होता है ना 120 डिग्री सेल्सियस 15 psi G प्रेशर जो होता है ना 15 mm/G, वहाँ पे pyrogen नहीं डिस्ट्रॉय होते. Corrosion can be disturbed by alternate temperature cycle, वो अलग होता है. So container can be made corrosion free by heating 210 degrees Celsius for 3 to 4 hours or by heating 650 degrees Celsius for 60 seconds. They may be removed by adsorption method and selective solvent extraction. So corrosion can be removed by this method. Okay, next criteria for your next criteria for your, now the purity of drug or API must be highly pure, then free from contamination and microorganism. तो आपका जो सोल्यूट है, आपका जो ड्रग है, उसमें कंटेमिनेशन नहीं होना चाहिए, उसमें कोई पैरोजन्स नहीं होना चाहिए. देन थर्ड इज नथिंग बट द एडेड सब्सटेंसेस, मतलब एडिटिव्स और एक्सिपेंट. So solidity and answer, we are using antioxidant, chelating agent, buffers, tonicity contributor, antibacterial drug, antifungal agents, then hydrolysis inhibitor, antifoaming agents. These we are using as additives, right? Antibacterial agent is not added in a single dose container. यहाँ पे antibacterial drugs or antibacterial agents are not drugs, not antibacterial agents or preservative. Antibacterial agent मतलब क्या है? Preservative. So it is not added in a single dose container and large volume parenteral. It is not added in the single dose container. अगर एक ही single dose container जैसे एम्पूल है, so it is not added in the ampoule and large volume parenteral. तो ये LVP और सिंगल डोज कंटेनर में ऐड नहीं किया जाता है, ये क्वेश्चन आ चुका है. इट इज ओनली एडेड इन द मल्टी डोज कंटेनर लाइक वायल्स. अगर वायल है 30 ml 25 ml, उसमें ये यूज करते हैं, सिंगल डोज कंटेनर में यूज नहीं करते. सिंगल डोज कंटेनर एंड पैरेंटल प्रोडक्ट में लार्ज वॉल्यूम पैरेंटल इसमें यूज नहीं करते. यू कैन सी डिफरेंस बिटवीन एम्पुल्स और एम्पुल्स, दे आर लाइक दिस. आपको इसमें ये इंजेक्शन होगा, आपको ये ब्रेक करना है यहाँ से और विड्रॉ करना है इंजेक्शन एक ही बार में. So it is a single dose container. Ampoules are the single dose container. Vials, you can withdraw 10 ml, you can withdraw 10 ml 3-4 times from vial. So vial in a capacity like 5 ml, 10 ml, 20 ml like this. So vials will have antimicrobial preservative, not your single dose container at large volume parenteral. ये LVP में और single dose container में preservative नहीं होता है, right? Next we'll see. So USP monograph of different water. USP monograph of different water very important है, very important. Okay. Water for injection and sterile water for injection USP standards. United States Pharmacopoeia standards क्या है उसके, है ना? So water for injection and sterile water for injection. So what is the pH of water for injection? It should be 5 to 7. Then for sterile water for injection it should be 5 to 7. यहाँ पे एक टेस्ट आया, यहाँ पे एक क्वेश्चन आया है ना, प्योरिटी ऑफ वाटर इज चेक्ड बाय, सिंपली आया था, प्योरिटी ऑफ वाटर कैन बी चेक्ड बाय, सो इट कैन बी चेक्ड बाय कंडक्टिविटी मेथड. प्योरिटी ऑफ वाटर इज चेक्ड बाय कंडक्टिविटी मेथड. नाउ कंडक्टिविटी ऑफ योर वाटर फॉर इंजेक्शन एंड स्टेराइल वाटर फॉर इंजेक्शन, दैट शुड बी विदिन अ लिमिट. कंडक्टिविटी कितना होना चाहिए? नॉट मोर देन 1 माइक्रो ओम for water for injection, not more than 1 micro ohm, that is a conductance, and not more than 1 mega ohm, that is a resistance, and approximately it is a 0.1. Purity of water can be expressed on the scale of conductance and resistance and ionic content respectively. So ionic content of water for injection is around 0.1 ppm sodium chloride. कंडक्टिविटी कितना होता है? 1.3 माइक्रोसेकंड पर सेंटीमीटर, याद रखना है. स्टेराइल वाटर फॉर इंजेक्शन का भी उतना होता है, 1.3 माइक्रोसेकंड, 1.3 माइक्रोसेकंड पर सेंटीमीटर. इसके ऊपर क्वेश्चन आ चुका है. व्हाट इज द कंडक्टिविटी लिमिट फॉर स्टेराइल वाटर फॉर इंजेक्शन? 1.3 माइक्रोसेकंड पर सेंटीमीटर. सेम इज फॉर वाटर फॉर इंजेक्शन. ओके, नाउ सेकंड होता है सॉलिड कंटेंट. इसके ऊपर भी क्वेश्चन आ चुका है. सॉलिड कंटेंट, what is the limit of solid content in the water for injection as well as sterile water for injection? So solid content is measured by, it is measured by evaporating the water for injection, the dryness at 104 degrees Celsius. 104 डिग्री सेल्सियस के ऊपर आपको वाटर फॉर इंजेक्शन या फिर जो भी आपका स्टेराइल वाटर फॉर इंजेक्शन वो आपको हीट करना है, evaporate to dryness, and you have to measure the. Now for sterile water for injection, वाटर फॉर इंजेक्शन इट इज अ 10 ppm. इसके ऊपर क्वेश्चन 2-4 बार आ चुका है. इट इज द Solid content limit for water for injection. Water for injection. Solid content limit is nothing but the 10 ppm. 10 ppm. What is the limit of solid content in the sterile water for injection? It is more than this 20 to 40 ppm. आप बोलेंगे सर स्टेराइल वाटर फॉर इंजेक्शन ज़्यादा प्योर होता है, इसमें ये सॉलिड कंटेंट ज़्यादा कैसे? उसका रीज़न मैं बोलता हूँ आपको. Am I audible to you? Am I audible to you? Okay. So 10 ppm is the solid content limit for water for injection. इसके ऊपर क्वेश्चन आ चुका है. Okay. और इसके ऊपर भी क्वेश्चन आ चुका है. So more water, more solid content is permitted. More solid content is permitted in case of sterile water for injection because during the sterilization of water. Okay. So what happens? It is sterilized in the some vessels. So particularly glass vessel, right? So that's why there is a leaching of solid during the sterilization in the glass vessel. In case of sterile water for injection, अगर sterile water for injection है तो उसको sterilize करना पड़ता है. Sterilization के टाइम पे जो vessel यूज कर रहे हो आप उससे वो leaching होता है, and that's why more solid content is permitted as per the USP for sterile water for injection. Sterile water for injection. So you have to remember this. So solid content limit for water for injection is 10 ppm and for sterile water for injection is 20 to 40 ppm. Now endotoxin limit दोनों के लिए सेम होता है. So 0.25 endotoxin unit per ml. 0.25 endotoxin unit per ml. Both should be okay. Now what about the pyrogens? So in case of water for injection, इसके ऊपर क्वेश्चन अच्छा है. In case of water for injection, water for injection should not be required pyrogen free. Water for injection should not be required pyrogen free. Pyrogen free नहीं होता है. Sterile water for injection must be pyrogen free. Water for injection need not to be pyrogen free, but sterile water for injection should be pyrogen free. Water for injection should not be held under room temperature for more than 24 hours before use. Now, water for injection क्या है कि you have to prepare immediately and you have to use immediately. You have to prepare water for injection immediately and you have to use immediately. You cannot store water for injection for more than 24 hours. You have to use immediately. And if you want to store, it is stored in the particular temperature 80 degrees Celsius. Remember. Next is nothing but the again monograph for different waters. Right? First, water monograph as per the US pharmacopoeia. बहुत ही ज़्यादा important है. यही part होता है. Now types of water. Water type. First type purified water. Purified water. Now इसके ऊपर क्वेश्चन आ चुका है. ये जो part बोल रहा हूँ. Now purified water is prepared by which method? Distillation and ion exchange. Purified water is prepared by distillation ion exchange method, and limit for endotoxin is not applicable. So it is used as a pharmaceutical solvent. Now, इसके ऊपर क्वेश्चन आया है. Water for injection is prepared by. You can go and check GPAT 2022 paper. 22 में क्वेश्चन आ चुका है इसका 22 में. GPAT 2022. Water for injection is prepared by which method? Water for injection is prepared by distillation and reverse osmosis. Distillation and reverse osmosis. It is a method for preparation of water for injection as well as sterile water for injection. ये sterile water for injection है ना, क्या है कि water for injection से ही sterile water for injection होता है. So water for injection and sterile water for injection they are both prepared by distillation and reverse osmosis. Endotoxin limit दोनों का same होता है, not more than 0.25 endotoxin limit per ml. Water for injection need not to be sterile, not non-sterile. It must be used within 24 hours. It is stored in a temperature range. इसके ऊपर भी क्वेश्चन है. So water for injection is not to be stored up more than 24 hours, but it should be stored in a less than 5 degrees Celsius or more than 80 degrees Celsius. तो water for injection अगर आपको स्टोर करके रखना है ना, तो कितने टेम्परेचर पे? लेस देन 5 डिग्री या फिर मोर देन 80. यूज फॉर terminally sterilized parenteral product. Sterile water for injection is prepared by reverse osmosis and distillation. Single dose container sterile water for injection is used for the reconstitution of sterile solid. तो क्या होता है Some preparations they are not dispensed as solution ड्यू टू स्टेबिलिटी इशू. जैसे एंटीबायोटिक के सॉल्यूशन इंजेक्शन होते हैं, एंटीबायोटिक इंजेक्शन में पाउडर ही रहेगा, बट उसके साथ में एक स्टराइल वाटर पर इंजेक्शन का एक छोटा ये भी रहता है ना, प्लास्टिक का छोटा सा एम्पूल भी रहता है. यू हैव टू स्क्वीज दैट एम्पूल, यू हैव टू बिट दैट स्टराइल वाटर पर इंजेक्शन, you have to put that syringe in the powder, you have to inject that water for injection in the powder, then you have to reconstitute, then you have to inject that final reconstitute to the patient. Bacteriostatic water for injection है ना, bacteriostatic water for injection. तो as the name indicate, bacteriostatic मतलब क्या है? So it is added with the bacteriostatic agent. So it is also prepared by reverse osmosis distillation. Limit is same. Limit entoxin limit आता है 0.5 entoxin limit per ml, and it is used for multiple dose and single dose product. So bacteriostatic water for injection is containing preservative और antimicrobial agent. इसमें antimicrobial agent होता है bacteriostatic. Sterile water for irrigation. Sterile water for irrigation. आपको कुछ internal organ का washing करना है. Irrigation means washing. Sterile water for irrigation means washing, right? So prepared by again distillation reverse osmosis. Entoxin limit होता है 0.25 entoxin unit per ml and used for irrigation and should be labeled as a for irrigation purpose only. Sterile water for inhalation prepared by reverse osmosis and distillation. Entoxin limit होता है 0.5 entoxin limit per ml and for inhalation therapy only. Inhalation के लिए. Water for next the water for hemodialysis. Water for dialysis, blood का dialysis करना है. Again prepared by distillation reverse osmosis. Entoxin limit 2 entoxin limit per ml, 2 entoxin unit per ml. Water for hemolysis is a drinking water for patient undergoing the hemodialysis. Dialysis जब चल रहा है उसमें water ये यूज करें. Water for hemolysis. Now excipient used in the pharmaceuticals. Excipient used in the parenteral products. Right? तो ये देख लेते हैं अपन. Excipient used in the parenteral product. तो क्या क्या excipient यूज करते हैं और concentration क्या है इसका. So antimicrobial agent पहले. So antimicrobial preservative. So they are added in a single dose container or they are not added in the single dose container and large volume parenteral. So they are added in the vials only. Multiple dose vials often included in the formulation to be sterilized by marginal process or made by aseptic manipulation. Antibacterial they are not added in the large volume parenterals and single dose injections. ये मैंने 3-4 बार बोला, क्वेश्चन आ चुका है. और benzalkonium chloride is used in 0.01%, methylparaben 0.01 to 0.18 है ना. myristil gamma picolinium chloride 0.7%, 70%, phenyl microic nitrate 0.001% per barrel, methylparaben 0.005 to 0.035, phenol 0.06 to 0.05. Stabilizers wetting agent ये अपने देखा है ऑलरेडी, ठीक है. फिर से एक बात है, to increase the solubility and act as a co-solvent or wetting agent or solubilizing agent. So dimethylastamide 0.01% में, disodium dioctyl sodium sulfosulfonate, glycerin in a 14.6 to 25%, polysorbate 20 0.01, 40 0.01, polysorbate 80 0.005, 0.05, polyethylene glycol 300 0.01 to 0.01 to 50, buffer to maintain the pH of preparation, adequate pH of preparation. Benzoic acid and sodium benzoate vapor 1%, sodium citrate vapor 4%, sodium bicarbonate 0.05%. Bulky substances autonicity modified, glycerin 0.16 to 2.25%, lactose menthol dextrose ये concentration है, सोडियम क्लोराइड का वैल्यू है. सस्पेंडिंग एजेंट कौन सा यूज करते हैं, जिलेटिन मिथाइल सेलुलोज पॉलीइथिलीन ग्लाइकोल सोडियम कार्बोक्सिल मिथाइल सेलुलोज. जिलेटिन एजेंट कौन सा यूज करते हैं, सोडियम इडिटेट है ना, सोडियम कैल्शियम इडिटेट है ना. स्टेबलाइजर में क्रेटनिन आएगा, ग्लिसरीन आएगा, नियासिनामाइड. लोकल एनेस्थेटिक में बेंजाइल अल्कोहल एंड प्रोकेन. ये क्वेश्चन आ चुका है इसका. हाइड्रोक्लोराइड इन 5% 5 to 1%, 0.5 to 1%. Local anesthetic benzyl alcohol and procaine 0.5%, 0.5 to 1%. Antioxidants अभी ये एंटीऑक्सीडेंट ले लेते हैं and we'll stop. Antioxidants. Okay, antioxidants they are used in the parenteral preparation used to protect the API therapeutic agent liable for oxidation particularly at a accelerated condition. मतलब जब टेम्परेचर बढ़ जाएगा या फिर ह्यूमिडिटी बढ़ जाएगी उस टाइम पे स्टोरेज की वजह से जो ऑक्सीडेशन होता है प्रोडक्ट में टू प्रिवेंट दैट एंटीऑक्सीडेंट्स आर यूज्ड. तो देखो एंटीऑक्सीडेंट दे एक्ट बाय डिफरेंट वे. So antioxidant they act as a reducing agent. Antioxidant they may act as a reducing agent. Reducing agent मतलब है antioxidant acting as a reducing agent मतलब क्या? So instead of your drug they will get oxidized. They are preferentially oxidized in place of your drug. तो वो क्या है? तीन है. कौन से? Ascorbic acid 0.02 0.02 to 1%. Sodium metabisulfite 0.01 to 0.15. सोडियम बाइसल्फेट 0.01 0.1 to 0.15%. तो ये क्या है? एंटीऑक्सीडेंट्स और रिड्यूसिंग एजेंट. एस्कॉर्बिक एसिड मतलब विटामिन सी. एंटीऑक्सीडेंट एज अ ब्लॉकिंग एजेंट ये क्या करेंगे? ऑक्सीडेशन चेन जो है ना वो ब्लॉक करेंगे. तो एंटीऑक्सीडेंट एक्टिंग एज अ ब्लॉकिंग चेन. इसके ऊपर क्वेश्चन आ चुका है. एस्कॉर्बिक एसिड एक्ट एज एंटीऑक्सीडेंट in the parenteral by following mechanism. So it get preferentially oxidized in place of drug. ऐसा क्वेश्चन आ चुका है ऑलरेडी जीपीएट में. Antioxidant act as a blocking agent. So by blocking the oxidative chain in the in which they are not usually consumed. जो ऑक्सीडेशन का रिएक्शन हो रहा है उसमें ये जो चेन टर्मिनेटर्स उनको बोलते हैं चेन टर्मिनेटर्स. सो एग्जांपल इज ascorbic acid esters BHT butylated hydroxytoluene tocopherol. Right. Now next आता है chelating agent. Chelating agent they will chelate the metals because metal ion है ना metal ion they are the responsible for the catalysis. So it will form a complex with the catalyst responsible for the oxidation reaction. Ethylene diamine tetraesteric acid EDA. Synergistic मतलब ये एंटीऑक्सीडेंट के साथ में काम करें. They will increase the effectiveness of antioxidant. उसमें phosphoric acid है, tartric acid, acetic acid. Are you getting? एंटीऑक्सीडेंट समझ में आया आपको? एंटीऑक्सीडेंट के ऊपर क्वेश्चन आ चुके हैं ऑलरेडी, ये याद रखना है.